Welcome to today's CT Style Express. I'm Natasha Lubchenko. Heart disease affects millions of Americans each year and can often be life-threatening if not treated properly. Joining us to discuss prevention methods is Dr. Essam Nakhla, a cardiologist at Waterbury Health. And at any point throughout this interview, you can scan the QR code at the bottom right of the screen to learn more. Doctor, thank you for being here. Talk to us about how important preventative care is when it comes to heart disease.
Yeah, thank you. It's my pleasure. Very important to look at your numbers and follow them. Preventive measures save lives and reduce misery down the line. That applies to your blood pressure, your cholesterol numbers, and also presence or absence of coronary disease. Luckily, we do have tools that enable us to detect even the very early stages of coronary disease. One of these tools is coronary CT calcium score, which I would like to briefly talk about today.
Sure. And I'm sure the earlier detection, the better. So let's get into some of these methods that you use at Waterbury Health. We'll start with the coronary calcium score.
Yes, so that's a low-dose radiation CT scan of your chest to focus on the heart. It detects calcification or hardening in your coronary arteries, even the minimal amount, and it scores it for us. It defines where calcium is, to what extent, and this makes a difference. Normal coronary CT calcium score is 0. No one should have any calcium in their coronary arteries because that's soft tissue. If calcium is detected, that is an indication of plaque built up inside the vessels and lumen loss and flow limitation, which would be followed with, if not treated, of course, angina and even other morbidities as well.
And now, doctor, who should be getting, exams like this? Who's a candidate?
Great question. So as per the current recommendations from the American College of Cardiology, American Heart Association, any person who is 40 years old with risk factors and or family history of coronary disease, especially if premature coronary disease in their family, should get this test to risk stratify and also to manage their numbers and treat accordingly.
And now you say that managing cholesterol level and hypertension are also important and things that you focus on at Waterbury Health. Talk to us about those.
Yeah, so your hypertension, if untreated, it will continue to damage your cardiovascular system silently. Misconception I always hear, I don't have any symptoms and this is my baseline blood pressure, which is 160/100. This is not true. There is no individual baseline when it comes to high blood pressure. There's certain targets that is defined with whole host of trials and well-established cutoff, which is 120/80 for most people. So if your blood pressure is 10 points, 20 points above this cutoff, you need treatment. It starts with lifestyle modification and adding pharmacologic treatment when appropriate.
And now these preventative steps, of course, are so important, and you just touched on this, but if someone, has symptoms that they aren't thrilled with, what are the steps that they can do to work towards a healthier heart? And how can you help them do this at Waterbury Health?
Regular follow-ups with your primary doctor or your cardiologist, making sure that your numbers, whether it's blood pressure or cholesterol, are within range, whether you are receiving treatment for those two conditions or you need to start on treatment. And also, of course, again, obtaining coronary calcium score to make sure that you do not have any coronary disease that started in the background and treated accordingly if you do.
All right, very important. And finally, before we go, do you have any other tips for, keeping our hearts healthy at any stage of life?
Yes, your lifestyle makes a huge difference. How active you are, what kind of foods you eat. And remember that there's also a very specific definition of physically active person. As per the American Heart Association, it's recommended that any person should exercise moderate intensity exercise of at least 150 minutes a week, and you can divide them however you want, 350s or 530s. But you have to achieve at least that much of time of exercise to get the benefit.
Doctor, very important information today. Thank you so much, Dr. Essam Nakhla from Waterbury Health. Thank you.
You're welcome.
All right, and you can learn more at waterburyhospital.org. Thank you for joining us for today's CT Style Express. I'm Natasha Lubchenko. We'll see you right back here tomorrow.